Let's take a look now at the big story, which is, of course, Omicron. Prime Minister Modi will be holding a review meet tomorrow on the current situation of COVID-19. Amidst a global scare on Omicron, cases in India have increased about 229 now. But the centre has also reiterated that our recovery rate at 98.4% is the highest since March 2020. The total daily number of cases also has not spiked up considerably, though new Omicron cases are being detected every day. Because of this, many cities have reinforced their restrictions. In fact, the DDMA, that's the Delhi Disaster Management Authority, has prohibited Christmas, New Year gatherings, political rallies, social gatherings as well. My colleague Danish is joining us with more detail.
As the Omicron variant is tightening its grip across India, the Delhi Disaster Management Authority today has prohibited New Year and Christmas celebration across Delhi. DDMA has also instructed the respective DMs and DCPs to keep a tight vigil around their areas wherever they find any kind of violation of any COVID rule. DDMA has also further directed the restaurants and bars to operate with 50% seating capacity. Apart from this, DDMA has also made it very clear that for marriages and other functions, the maximum guest limit that one can have at their particular function is 200 people and it cannot exceed beyond that. DDMA has also banned all kinds of political and sports gatherings around Delhi. So if we see this development has come at that time when Delhi is leading the nation's Omicron tally, so the big takeaway is that the Delhiites might not be able to enjoy Christmas and New Year this year the way they have been doing it from the past many years.
While the world is battling with trying to figure out what the Omicron really means and how severe it can be, a lot of questions abound. Joining us today on the show is someone who is very highly regarded with his advice and his sayings on COVID-19 right from the beginning of the pandemic in 2020. Joining me now is Dr. Faheem Younus. He's the Chief of Infectious Diseases at Maryland University. Dr. Younus, great to have you on the show. Great to have you back again. Let me begin by getting your take on Omicron. Now, there are two kinds of narratives on right now. One is that yes, it spreads faster than Delta, but it is less severe, nothing much to worry about. The other is where you're seeing governments around the world really going into a panic, coming down with restrictions. What do you think is the true picture? Is Omicron truly less worrying?
Right. So generally speaking, we're still learning about Omicron, and I tend to avoid the extreme narratives. One narrative that this is just a very weak virus and we don't have to worry about it. And the second narrative on the other extreme is everything is a breaking news and this is just all hell breaking loose. I think the truth is somewhere in the middle. We're still learning about this pandemic as we are still learning about this new variant. The good thing is, despite all the projections, predictions, and uncertainties, the basic principles of defense remain unchanged. Vaccines work, good quality masks will protect you, and that's how you can continue to live your life. So I think instead of focusing too much on the uncertainties, I want to make sure that people remember what actually works, because you can talk all night. At the end of the day, we are going to come to that same old action item. And that is something I wanted to emphasize out front.
You're saying that, but are vaccines really working? We're seeing more and more cases of immunity breakthrough, people with 2 doses also testing positive for the Omicron. And the question is that would boosters actually work? Because these vaccines were made for the original Wuhan virus. What we're seeing right now is completely different, isn't it?
I don't see it that way. The way I see it, there is a clear decoupling of cases versus deaths. Wherever you see Omicron dominant, you can look at Denmark, you can look at UK, you can look at South Africa. Everywhere there is a spike in cases, but the deaths are not spiking to the same proportion as it used to happen in the previous waves. Part of that could be that the variant itself is not as virulent, but I think community immunity clearly plays a role. And a lot of studies that you're reading about vaccine escape, this is humoral immune escape, which means just the antibody in the laboratory. that is being tested. Immunity and vaccine-based immunity is much larger than that. Antibody is just one side of it. The T-cell dependent cellular immunity and memory cells is not easily measured. So I don't think that it's fair to say that vaccines will not work. They may lose some efficacy. And the example is, it's not a light switch that goes on and off, it's more of a dimmer. You may lose, the light may be a little bit dim, but it still be enough to kill the darkness.
What about vaccines that we've taken here in India and which are available here? Covishield and Covaxin. More and more studies showing that after a certain period, especially after 6 months, their protection against Omicron is pretty low. So would they work? Do we need boosters? And would the boosters of these vaccines also work?
That is correct. The neutralizing studies currently are showing that mRNA vaccines are better than vector-based vaccines or the traditional vaccines. And more than 2 billion people in the world actually have received those more traditional vaccines. But I think it's simplistic to say that means people shouldn't vaccinate, because at the end of the day, I think whichever vaccine you have is still better than no vaccine. And I believe that people who are vaccinated will always have a distinct advantage over those who are not vaccinated. Now, yes, more data is coming. Even on the 2 doses of mRNA vaccine, we now know that Omicron pierced through those 2 doses and will cause infections. And that is why a 3rd dose is necessary to reinforce that sort of weakness in the vaccine setup. Down the road, there may be more bivalent vaccines, meaning that have both Delta and Omicron protection, or just Omicron protection. So we will continue to retool these vaccines at the same time. People should know that whatever is at hand is still better than nothing.
Well, the big debate here in India, and this is a 2-part question for you, is whether we should first cover everyone who requires vaccinations and then boost, or should we give booster shots to those who are most vulnerable? So in your view, should we first cover everybody, or should we now allow boosters as the Omicron threat grows? And is it worth giving a booster of Covaxin or Covishield?
Right. So multiple questions here. And let me start by first saying the best thing is to first call it a 3rd dose, not booster dose, because we now believe that the full course of COVID vaccine is 3 doses. This is nothing unprecedented. Hepatitis B vaccine and some other vaccines have similarly 3-dose courses, and we're learning along the way. So I don't think it's something which is scientists are changing their position. We're just learning more along the way. So first of all, it's 3 doses. Whether we should change the strategy or not, it's a very difficult decision, complex decision with multiple variables. I will trust the people on the ground to make the determination as to, from a political and policy standpoint, what's the right decision. But scientifically, I think that the science is pretty clear that yes, people who are working on the front line or those who are immunocompromised, if it's been 6 months or more since their 2nd shot, that they should get the 3rd shot. The science is pretty clear that you can mix and match the 3rd shot, meaning if you got AstraZeneca, you can now get Pfizer on top of it, or you can get Moderna on top of it. Where the science is not very clear is if you don't have Pfizer or Moderna available, then what to do? If you got 2 shots of Covishield or Covaxin, should you get the 3rd of the same? I have not read a lot of published work on that, but I personally think that it's still better to give a 3rd shot to people who are vulnerable, at least healthcare workers and those who are immunocompromised.
What about vaccines for children? In many countries around the world, children are now getting vaccinated. This is not happening in India, and one of the reasonings being given for it is that children seem to be more protected. They don't contract very severe diseases. But as these mutations continue, don't they need to be protected as well?
So it's pretty obvious by now that children are more protected against this variant and this virus, particularly those under the age of 5. Their outcomes have been largely no different than previous years of influenza here in United States, which is reassuring. Those between the age of 5 and 12 and 12 and 18, as the age goes up, yes, you will see a little bit more severe illness, risk of long COVID, all of those things are there. I think the largest advantage of, in my opinion, the largest advantage, the greatest advantage of vaccinating children is ending the pandemic. So they don't become a tool of transmission and the overall transmission chains can be reduced and broken. But all of this is to some degree first world problems where we have a lot of access. At the same time, we have a lot of vaccine hesitancy. I think in countries where there are access issues, it has to be prioritized, and the priority has to go to elderly, immunocompromised, and those with underlying conditions before going to children.
Now, the World Health Organization has said that 2022 will be the year when the world must end the pandemic. Are you hopeful this will happen, Dr. Younus?
I think it will end in different countries at different times. Globally, I don't see it ending in 2022. I will be pleasantly surprised and will be honored if I'm wrong. My goal is to protect mankind as best as I can as an individual. But the degree of vaccine inequity, the degree to which we've turned this public health issue into a political debate, the divisiveness, the polarization that this issue has created, I personally think the ripple effect goes years beyond where we are today. But yes, many countries will be out of this pandemic. Those who will align themselves with science and those who will not turn this public health issue into a political wedge issue, yes, they will be out of it in 2022. There's very little doubt in my mind.
Well, let's hope for the best. On that note, I want to thank you so much for joining us today on the show.